The guest I have on today is Curtis Handy, who is a student in Southwest Virginia that switched careers from mental health, very cool, to come to OT. He is active on campus as co-chair of the local COTAD chapter, COTAD, Coalition for the Occupational Therapists Advocating for Diversity, and collaborates with other males like myself, OT students on campus through the Bro T Brain social media pages. Welcome to the show. How's it going?
Good. Thanks for having me on today.
Of course. So the first question I like to ask my guests is, tell me about yourself, how you found OT.
Yeah, so I grew up in Virginia and then found a private university I went to and learned a little bit about OT there. But I ended up majoring there in liberal arts. Mm-hmm. And then I focused on psychology as well as some sociology classes. And I mostly stuck toward mental health for a long time. I did know about OT, but I worked at the Boys and Girls Club for a little bit. Then I worked as a direct support professional within a psychiatric block facility for dual diagnosed adolescent teen boys. It was a private one. And so I worked there for about 5 months, and then I got a position as a registered behavior technician working in applied behavior analysis. And I ended up collaborating with an OT and a speech therapist for a year. With a client, we were targeting communication using the picture exchange communication system, at least on, that was one of my goals, and that we kind of all collaborated on. Found out, about OT more and actually saw it in person. I was like, oh, I really like this. I think I want to do this instead of ABA, which I was kind of wanting to focus on. But I found OT, and then in 2017, I decided that's what I want to do. So I stayed as a RBT for a little bit, and then mostly pick careers in mental health that would support my, work in school and academia to be able to apply back to graduate school to become an occupational therapist. So I was a case manager for PAC program, which is assertive community treatment, more intensive case management. And then I worked for a state program called REACH, and I worked in REACH Region 1 in Charlottesville, Virginia, as a therapeutic support specialist, and a little bit informally the assistant director by doing some supervision for staff, as well as training staff on groups. But in that position, I mostly just ran a lot of therapeutic programming for the entire crisis home. But yeah, so about right after that position, I was able to accept it to 3 of the 4 schools I got in, I applied to, and then I ended up choosing OT, and I guess it's semester semester 4 now. Doing great and still enjoying it. Don't regret any of this at all. I love it.
That's awesome. How many more semesters do you have to go?
We have 1 semester that's mostly academia, and then we have the last 2, which are fieldwork, placement 2. So I'm looking forward to the fieldwork because I'm ready to get back working again and seeing more of that on the field, real world applicability of OT. So yeah,
getting back, basically putting what you learned in school and what you had in your experience to use, and it's such a different thing, like going back to school for me, like getting a break from like healthcare. It's like, okay, it's kind of nice though. I mean, you're on break right now too, right? For the holidays.
Yeah, exactly. And I was feeling the same way, with the, before coming back to school. I was like, I really want to take a break from working and go back to school, but I'm feeling the exact opposite now. It's like, oh, now I'm going back to work.
Yeah, there you go. You have no choice. So in those experiences, were you exposed or worked with OT? Like, just like you had a whole range, but any of them like that come to mind that kind of like made you kind of go into it too? I'm sure there were more of it in certain places.
Yeah, I would say the biggest was definitely between being a registered behavior technician and then being a case manager. So for the registered behavior technician, it was only because I was really collaborating an hour a week with a client that I had with an OT, and I asked some questions. I was like, she mentioned words like proprioception and vestibular, and I was like, I've never heard these words before. Can you educate me on what they mean? And so we just had a lot of good conversation, and I was still in the mindset of like, I definitely want to get my master's degree, but I didn't know what I wanted to do. I just got out, so seeing what she was doing, hearing about, different sensory systems and fine motor, gross motor skills, stuff that I've never really been educated on or really knew much about. So that was a really big kind of seeing OT in the field, in that pediatric outpatient clinic, and really interacting with her, seeing that, our personalities are similar, and that, I could get my master's degree and I could do that too, and getting that confidence, really in that position. So next would be like when I was PAC case manager. And the reason why this is a really important position to me is because I worked on a lot of independent skills within people's, like in the community. So as a PAC case manager, we had clients who, to be in PAC, you have to have a diagnosis of schizoaffective schizophrenia or bipolar disorder. Okay. And the reason is that the research behind PACT works much better for those individuals with those diagnoses. So that's why the program is geared more toward those individuals with those diagnoses. But the focus for that position was a lot of independent skills like cooking, IADLs, ADLs, like all of that within the community to make sure that they could stay in the community and didn't necessarily need to be hospitalized. And so finding a lot of supports that they, in the environment that we could potentially modify or adapt, as well as looking at routines, as far as time management, and then helping with medication. So just doing a lot of that. And then in that position, of course, I was taking classes to apply to grad school for OT. And so I was taking anatomy, physiology, medical terminology, and was able to use the skills. And then because of the interest there, I was able to look up what OT looked like within kind of that setting.
Yeah.
So I found out about PACT and ACT teams up in Canada where OTs work as an integral part of the team and have their own kind of roles and, a really good team player within that PACT model. So that's another kind of way I saw like the role of OT, how much they could do and the value of OT, and especially within mental health for me. And
right.
So those are like the two positions for me that I saw OTs the most. And then as far as working in mental health, though, you don't see as many occupational therapists unless you go to some state facilities. I did my shadowing hours at Psychiatric State Hospital, and I met a lot of really awesome OTs there. Really inspired me again to continue the journey I was on. Mm-hmm. But as far as within the mental health field, you don't see as many right away. And then when I was working at ABA, that was that's really geared toward individuals with a diagnosis of autism or developmental delays. So the reason I think I saw OTs in those settings was because the parents had kind of found that support from an OT, but a lot of individuals necessarily don't know how to receive that support or find an OT.
Right.
Yeah.
I think I recently did a research thing into like the trends, and I think mental health OTs are only like about 2% of 2019. And also it's been decreasing. I think it was like 3%, 4 or 3, and then 2, and now it's like 2.0. So hopefully we can reverse that trend because the world needs OT, like I think it sounds like what your experience with OT was in like the hospital system, not so much besides the PAC, that was like more community based, right? From what I understand. Like life skills.
And then I will say I've not seen any OTs in a PAC program outside of Canada. So
I want to get back into the OT program because your experience, I think we have a similarity going through OT school as a male is, I would say, a little different. And I even looked into some of the research and definitely I would say it's different. Like basically male versus female, you definitely feel it. Like, right, you're like not many guys. How many were in your program actually?
Yeah, so I was thinking about that too, because I think about that all the time about how many men are in programs. I will say before applying to grad school, I assumed that I may just be the only guy in the program or two, but there is a total of 4 on my campus. So my university has basically 2 campuses. OT cohorts can be on either one. So for the 2 campuses for the second year OTs, there's 4 on our campus, 3 on the other campus. But for the year younger than us, the cohort younger than us, so the first years, it's worse. It's 1 guy per campus. So it's
What percentage
they're
or
the
like
only one.
what percentage would
Yeah,
you say?
1 person. Just one guy. So I think it's a total of like 44 students across both campuses for the first years, but only 1 guy is on either campus. So I think it's like 22, 23 individuals here in Roanoke, Virginia, and then the only 1 guy in the program. The same is true on the main campus at the other university. It's only 1 guy and then like 22, 21 women.
Yeah, I probably would guess for most experiences, if you asked, it'd be the same situation because it's very similar for me too, both my class and the like ones before. But it's interesting, like when I did my field work and stuff, like I saw a lot of male OTs too. Like it was at like a skilled nursing, and it was like 3 or 4 to. So I was like, oh, cool. Like this is what I knew going into it wasn't going to be a lot of males, but then it was just like such a big contrast. And then I think I read online it was like 90% ish in 2019 female to 10%. But it seems to me even less than that, like in real world. Yeah.
Our professor had said, I think this year that he read a statistic, it was like 8%, I think now. So I think it actually is going down in a downward trend, but
Yeah. Any ideas why you think that's the case?
yeah. Well, I'll say for me, it took me, I think 3 years to really understand like what OT was and if I wanted to do it. Everyone had talked about its relation to physical therapy, that it seemed like it was almost a sub of physical therapy.
Yeah.
And I feel like it's partly the education fact. I think that I think once a lot of guys hear PT or OT, I think they just go right into physical therapy. And I'm not sure necessarily why that is, but that's almost my route as well. I almost went straight into physical therapy. And the reason I didn't do that was, I think, because of my background in mental health and working with individuals with developmental disabilities. And so with that experience, I think I was able to kind of see a little bit more. I was already a little bit more holistic in how I, viewed my clients and their challenges that they faced.
Right.
So I think for individuals outside of healthcare, maybe just kind of going into different professions, I think to really state the value of OT, I think is difficult for those, for individuals who may not have an understanding, maybe holistic care and holistic health,
Yeah.
and things of that nature. And then PT is such a dominating force as far as like when marketing and people just know about it. It's just word of mouth, and I think it's pretty easy to understand what they do. And I feel like just a lot of guys kind of go toward that route as well. I understand them going to more things I think they just hear about. I really just think it's just word of mouth and just knowledge. Like I worked a lot around, mental health is I would say it's definitely more, I saw more women in my career positions than men. And so I was already in a more female dominated field to begin with.
Yeah.
So again, I think if I would have heard about OT, I probably would have leaned more toward PT, just because they sound similar when you just hear them off the bat.
Right.
So I think it's just people just need to dive in more deep, and we need to probably just be expressing the value of OT more. I think that would really help.
Yeah, I agree with those points. Like for me, it was like I didn't know about it, and I was looking into healthcare. It was like OT wasn't even on my radar. So it's like, how would OT be found, right? Like if you think about it, like to try and find it, it's easy if you know you're looking for it. Like on like social media, type it in, like there it is, and like there's so much around it: podcasts, social media, articles. But then I feel like it's not on your radar. It's like so much harder to find. It's like maybe it's because other professions have such a dominance, like you said, like PT or like nursing. I would say, right, it's like huge right now because it's like such a shortage, and then like. Yeah, it's just like the nature of maybe like the culture. But like even when I did learn about it, it was just like I was still like, I'll still try to apply to like PT school and like do other things. And then it was don't want to say it was like my last choice, but it probably was a combination of me not understanding what OT really was, or nobody really like explained it to me. I wasn't exposed to it.
What can I ask? What made you decide OT versus PT, and then yeah.
So originally I was on track to become, and I was doing basically my prereqs, and I was an EMT while I was doing these. And I was thinking, okay, a lot of these prereqs would align with other programs, like PA was one of them, nursing, PT, and a lot of it was just like my bad timing, like procrastination. So I like missed a lot of deadlines. And last thing was probably that made the biggest decision was just me envisioning what I could be doing. So I was like, PA, like the schooling was just like very intensive 2 year. And like, it was just that role of like, kind of like a gatekeeper and like, you know, to healthcare. And it's just like, I felt like that really wasn't what I wanted to do in terms of like, just like looking at conditions and conditions. And then PT was like really, really cool, you know, but then I think it was just like missing one piece. And the OT part, what I like really appreciated and like loved was like that creativity part and integrating so much of it. It's like, wow. And not only that, but doing actual things like in the real world and that are meaningful to patients. And because I myself wasn't like a big like exercisey physio person. So like, I don't want to like say like kind of like fake it till you make it, but like me telling like, oh yeah, you know, do this and that. Like, it just wasn't really in embodying what I was doing as my lifestyle. Like I had a lot of other varied interests in other things, like creativity part, like designing things or like integrating things in life and like experimenting, listening to music, you know, like I worked out, but like even then, and I say this a lot in my content, like I'm not a really big fan of like just working out to work out. Like I love doing real things like building like my gazebo or like working in my garage or going out in nature and like, you know, like not being in the gym. Like, so I was like, wow, OT can like fill those gaps and then some with other areas of like mental health and like other specializations like hand therapy and other things that if I were interested down the line, I could just jump around. And not only that, wasn't many guys in it. I was like, wow, I'd be a really great candidate, you know, because I can talk about my story and how I can bring diversity, you know, just being a male where I feel like that can be something special. Whereas in other professions, it's like, not so much, but like male in OT is like, wow, you're like, you can shine and talk about how you can bring your skills and your knowledge and experience.
Definitely. I definitely have a similar, I think, story to that too, because I was mostly, again, I think my experience in mental health, I think really pushed me more toward OT because after about, again, I think like 2-3 years, I was really having difficulty really deciding which one I wanted to do, because if you just do some research or Googling on and just quick readings, nothing about like from an OT in depth about what, you know, OT is, what they do, you know, it's typically I was finding a lot of the stereotypical, you know, OT. Oh, it's the hands. Oh, it's upper extremity. You know,
Yeah, that's
like
true.
that.
Yeah.
Yeah, ADLs, and I was like, oh, okay, well, you know, what is that? And eventually, my mother-in-law works as an office manager for an outpatient and inpatient OT PT clinic, like works like basically out of a hospital. And I was able to have an informal conversation with the director there. She happened to be a PT, but she was also the director of the program. And I probably spent an hour with her just, you know, asking questions about PT, what's OT, you know, what's the application of it. And, you know, the two things I remember her saying the most was that, one, you know, if you choose PT or OT, it's, you know, it's good compensation for your investment in education.
Yeah.
So the amount you're going to invest in your education, it's going to be worth it, you know, coming out in the compensation you receive. And it's like, okay, that's good to hear, because I was not hearing that about social work and, you know, counseling. So I was a little concerned with those two career options. And then the next thing was that she said I can work, you know, with, you know, more of the medical model kind of side of, you know, working on symptoms and reducing symptoms, but as well as I could still work in mental health settings, as well as working with individuals who have developmental disabilities. And she said the variety of the field was so large, and the variety of roles that an OT could do was also large. So I can, that's another thing that drew me to OT. And I think after that conversation is when I fully committed, started looking at OT schools, and it was like, all right, what do I have to do to be an OT, and what do I have to do to get into the program and make that happen? So that was like, the biggest conversation for me. And when you mentioned about the variety of positions, that was another thing that called me, because I saw so many individuals within, with a master's degree in social work or a master's degree in counseling. There were licensed individuals, licensed social worker, and a licensed counselor.
Yeah.
But all the individuals I had talked with, they seemed pretty burnt out, switching careers a lot. And then they talked about, always kind of struggling on the compensation end, because, there were jobs that did pay okay. And then there was some positions that weren't paying, very much to even afford to, cover their loans that they had taken out to get the master's.
Right.
So, yeah, I kind of found a similar way to get there, but a lot of it was just kind of looking at a lot of different professions, and then at the end deciding between PT and OT, and then just seeing like the amount of more the holistic perspective I think that OTs have, and the variety of roles that they can target, or the variety of roles that they hold. And so I think that was my biggest draw to really come into OT. And then, the man thing. I mean, every time I saw an OT and I mentioned about being an OT, it was like, oh, you're a guy and you want to do OT? It was like, you're going to be amazing. They're going to love you. And I was like, oh, just because I'm a guy?
Yeah.
Oh, okay, cool. I thought maybe I had some, inherent quality or innate quality that would maybe just help me in the field profession. That was like a little, like a bonus point. So
there you go.
Like, well, why not? I'm going to go for it. So, and again, I still enjoy being, and I do not regret the program or choosing this career path.
Yeah. I think everyone has their own journey, and we'll talk about it a little bit more. But I had a question about, what would you say, like, how would you advertise it to guys like that are listening to this show? Like, this just happened to drop in. Like, how would you sell it to some of the dudes out there?
Yeah, I think the biggest thing is that, you're not pigeonholed within just working on one thing. You can help individuals through many mediums, through many different roles, in many different settings. We've heard of, individuals who, okay, for instance, we had a lecture recently, and it was a male OT, and he was kind of in charge of this university's 3D printing program and the education behind it. And he'd also work with community members and community providers and help create 3D printed objects for the community members. So that's just one kind of more alternative way to be an OT, but also still help individuals.
Yeah.
And for those who may be looking at, counseling or social work or even PT, it's not, you're able to help individuals through a variety of treatment and things that are meaningful to you. So if you like more of the physical route and you think that this individual may need, strengthening or increasing range of motion, or, really needs to just be active, and they might, get a lot from that. You can target that more, but you can also be focused on how their social life is, or how they can be more creative, or get more meaningful time in other, different occupations. So yeah, I think when it comes to OT, it's just a lot you can do, and you can really use those creative skills that you may have inherently, or maybe you want to try. It's really just a field that you can really make it your own, and that's one of the biggest things. That's the biggest thing I would say, is that you can just really make it your own. Exactly. And really find your passion and how you want to use that passion. It might take some work to do it, but just like all things, got to put in a little bit of hard work sometimes. But, right. Yeah, I think if you want to feel that you can kind of make it your own and help individuals, and that's really rewarding to you to have those situations and events where you can help somebody and they're really thankful for that, and it just means a lot for you. This is definitely a field for you, because you can make it happen in a lot of different ways, and in the career compensation for you investing in yourself to get the degree is definitely worth it. So yeah, you learn like I don't know about you, but like once I went to OT school and I like learned some of the theory and like the way we see the world, it's just like, whoa, this is like really cool stuff. And like example was like how we looked at
I think it was like I think it was like the model for like attention and like how we see it, and then how you have like language and like vision, and it's sensory input basically. And it's like, wow, how we see the environment is like so cool. And not only that, now we're looking at like modifying the environment, like lighting, for example, like vision. Recently, I've been doing a lot about like hearing, and like even just like it's so huge, and like we don't think about it because the world is made for normal, able-bodied people, right? And like doesn't work for everybody. So it's like that is like something you like take really creative and go in like so many directions, like you said, and like the potential is there to like really help people.
Yeah, I definitely agree with what you said there. But just to be able to view things in such an expansive way, it's
Hmm.
not. I think that was the biggest thing when I worked in mental health is that I so as a case manager, you mentioned like PA and seeing kind of what they were doing. That I would do that a lot. I go into doctor's offices with like medical appointments with my clients, and I ended up being me as the one to kind of fall back and actually educate them on
Huh.
what it is that the doctor's saying, educate them on how to follow the routine of the medication management, as well as like understand, like, can they, like you were saying, the hearing sight, like everything is so connected
Yeah.
that we can't just kind of look at things in pieces. We have to take the big picture and look at the that full person, and seeing how things are, the dynamic interaction of all those systems, and trying to go about life.
Yeah. Well, that's a really good point. It's like really easy to get caught up in like the medical model, like especially with things like symptoms and how people present, like very bottom up, right? We call it bottom up. But instead of looking at the holistic, it's like what's like just step back, and it's like it can be really, really intuitive if you like just like take a step back and look at it. It's like, okay, maybe this person's just like not getting enough sleep or something, right? It's like affecting their mental health. Like, and then you can like, it's kind of like, I think it's fun because it's kind of like investigative work. And you're like
Yeah,
asking the questions and like doing what like makes the person like really like get motivated and makes them like wake up in the morning. And it's like really meaningful work that I'm not saying like other professions aren't, but being able to tap into all those things and like what may have kind of like the fire that died, the flame, because they had an injury or like a condition. And it's like, how do you want to get back into that? It's like really simple, but at the same time, it's like so powerful. It's like what drew me, anyways.
yeah. Another thing, I'll kind of speak a little further, but one of my favorite things about OT is that there's a word for basically using your own self to enhance therapeutic events. So like the therapeutic use of self. When I worked in the many different positions I had in mental health, we would discuss active listening. We would discuss unconditional positive regard,
Hmm.
and all these different terms for basically therapeutic use of self.
Hmm.
So I really appreciate OT's push and value they have on that approach, and to use therapeutics of self. And I feel like that's probably one of the, I believe that is one of the most impactful things that we can do as OTs, is use that therapeutics of self.
Right.
And that, another reason I enjoy being in the OT profession, to have something like that.
That's a good reminder. Yeah. I think that's what like the feedback I get from like my patients and like my coworkers who hear stuff from my patients is like it kind of just boils down to that therapeutic use of self. Like the personality, I guess, is well, how it kind of, those of you don't know, it's kind of like you're using your personality and like how you interact as a form of therapy for that individual. And how would you define it? Like roughly.
Yeah. Yeah. So I would say something similar. So I would say that, but I think it's just basically how you use yourself to enhance therapy overall. Um, Really just, I don't know, maybe some words like empathy, active
Hmm.
listening, just not judging the client or their situation.
That's huge.
But yeah, so what I did recently for a class, I had to do a training in kind of a psychosocial realm, and it
Mhm.
was on motivational interviewing.
Oh, yeah.
And so the trainer talked about some research that was done for, and this is more the medical model, so physicians and doctors, and he was saying that the one thing that seemed to be impacting therapy, or sorry, impacting treatment's efficacy, was practitioners' use of empathy. So how that was like the one determining factor whether or not, the treatment was going to be efficacious. So that to me shows the power of therapy use of self, that being able to use ourselves in ways that are beneficial to the client can really impact therapy overall, and how the use of, paying attention, listening, and being empathetic, and not being judgmental, and just being there with someone else while they're going through that hard time, and being willing to collaborate and guide someone through that, I think is the thing I think is very, very important within therapy use of self, and just why the value of it, I think, is so high. So.
Yeah, that's definitely one of the areas where it's like, I think I learned about it in OT school, but I read more about it after OT school, and like the things that this type of therapy and like phenomenon can do is like really powerful. Like you said, in the motivational interviewing, in like one study, they were able to find it help people to make better decisions, like quitting smoking, quitting drinking, like substance abuse disorders, right? Like they go into like, well, why do you want to quit smoking? And it's like, well, we all get caught up into things like suppressing what we don't want to do, like the alcohol, being sad, depressed, like weak, in pain. But it's like, well, there's a whole nother world of things that you want to do, right? Like, what are you motivated by? Which gets into that OT part. And that therapeutic use of self really, I think, builds that relationship. And I see like a lot of other OTs, especially the more seasoned ones, they say, we're not seen as this expert role, like where it's like hierarchical, like doctor, or like physician or whatever. It's more like collaborative. And I think once we use that therapeutic itself, we're like on that same plane. And then we like you said, empathize with them, and we're able to kind of like get their buy-in. We're not really like convincing them, like especially in motivational interviewing. It's like our role isn't to convince somebody to do something. Like it's just like as a guide and unlocking what their thought process is. And like, it's really and I think that really works because it's like what they really want to do, like inherently.
Yeah. And I will say, so I'm in grad school now, and I'm not necessarily working full time as I previously had with clients, but I was able to pick up something part time where I work like with foster care youth who are in like an independent living program. And so I work sometimes in the evening from like 6 to midnight, basically.
Wow.
Yeah, just helping either work on like life skills like cooking or grocery shopping, how to clean or manage the home. But the one thing that I wanted to do when I came in that position was, my first thought was, I can't just go into these residents' apartments and just tell them, okay, you need to do this and you need to do that and you need to do this. It's not going to work. Which I feel like is, similar when you go to the doctor. It's like, all right, take this med, go do this referral, and exercise more, smoke less, like all
Right.
this stuff. And but I knew that the one thing that was going to be beneficial is if I just built rapport and just try to get to know them, let them know me, get this, good relationship before they can feel like they're going to listen, to what I have to say. Because why is someone coming in? Why should they listen to me? What's the value that I have if they don't even know who I am or what I bring to the table, or if I'm even going to willing to listen to them? So I've been working there now for about 3 or 4 months, but I had a really good feedback from my supervisor, and she said that she's like, yeah, like so and so, don't want to say names, but so and so was like, like basically says that like you're their therapist now, because when you come in, like you listen to them and they, they're feeling a lot better about like how they're doing overall, because he had been saying like he'd been feeling really depressed. So all I've been doing is I've been going in, just having short conversations with him when he gets off work in the evening. And we talk about certain things to work on, or, how he's feeling, and just processing things,
Yeah.
asking questions. But to him, it's just been, I really haven't done anything. Like I haven't given him a miracle drug. I haven't like done all these. I've just really just been listening, and I've just been there to help him process through things. And then have suggested a few things here and there. But it's not been a suggestion like, you do this. It's been, hey, let's do this together. Like, for instance, this individual wants to work on losing weight and just overall just better health, like with nutrition and active lifestyle. So instead of just being like, oh, go to the gym more or do these things more, it's like, why don't you come with me and we can do things together? So again, it's that collaborative approach rather than, and so far, again, it's been really beneficial because this individual states that, that I'm basically his therapist and I'm not, I mean, I'm just going in and just talking and processing with him and inviting him to things that I think he would enjoy that align with his goals and that things that he would, I think find meaningful outside of, like you say, just working out to work out, trying to find things that are more active without having to, be like, I'm working right now. So.
Yeah. Kudos to you, man. It's like, I think being a male too, like being able to relatable, like as an OT, like definitely helps too. So those of you guys who are listening out there, audience, like, or who are males, or you're female and you have like a husband who's like changing careers or something, maybe you want to have them look into that, give them some pamphlets because there's a lot of potential there. Would you say there's a social component to it that therapy and OT and that mental health? Because I think personally, it's probably is huge. Like a lot of the pathophysiology, how mental conditions, it's like they kind of get isolated, right? So what do you think about that?
The social aspect, yeah, I think that plays a huge aspect. I've already been interested in let's say like men's psychology or men's way of thinking and the culture of I think that men have within the U.S. Of course, I've not really lived much outside of the U.S., so I can't speak to other cultures, but I do think there's a bit of social isolation that that plays into some of those issues.
Yeah.
Because as I talk to some of the men that I work with who are like in their 20s, I mean, 20 years old, they discuss, like, oh, I got to work really hard, make the money. And, I just got to be tough and just push through this even. But I can tell that they're missing people, that they're not as happy with their lives and that they're not, getting the connection that they necessarily want, especially with other men.
Right.
And the one guy I do push, I'm like a little bit, I'm like, well, have you messaged, so-and-so and see if they want to hang out? And, we'll be really quick. And then he'll be like, no. I'll mention like ways that he may want to try to hang out with some other guys. But I do feel like the social aspect is a huge piece, especially after COVID, when I feel like individuals tried to find what was missing, which I believe was a lot of that social aspect through some type of digital medium. Because a lot of times now when I go into the residents who are between like 17 and 20, and it's only like, there's only 5 of them. But I noticed that a lot of times they're on some type of chat with their friend on the phone. And so they're holding their phone up on a chat, but they're not, it's usually just kind of in the background, just kind of in the room with them.
Yeah.
Like as if you're like hanging out with somebody and it's like they're just like in another part of the room, you're doing work together. It's kind of like that, but it's on the phone. So I'm not sure if that's as meaningful or not. And it has the same value for those people. But I'm really seeing, I do feel like there's some kind of social aspect though for men and that. So I agree.
Yeah, maybe it's a cultural thing. Like I find myself actually thinking about this a lot. Like I think definitely with COVID, but just inherent to my personality, I just lost a lot of the social connections, especially to like with guys. It probably is a biological thing. Like it's hard to explain. Like I don't even know, but it's like, and I do want to like reach out and socialize, but sometimes I just think it's like easier in some ways for like females. Maybe it's just like, it's hard to explain. Like I think maybe men don't talk about like their emotions and they're less open. And like they keep it to themselves. That's definitely probably one of the things that is a barrier to us dudes, like connecting with other dudes, like, yeah.
Yeah, I think there's something to say to that because, I mean, I've been trying to do the opposite of that on my campus because, so we used to have like our second year OT, and I'm included in that. There's a total of 7 guys across both campuses. So I was able to collaborate and we were able to do a podcast together and we kind of dived into a little bit of some of those issues, but as far as my own experiences, when I'm like, let's say when I first got into the program, I was a little hesitant to reach out and try to be a little more vulnerable with guys. I feel like, at least in my experience, when I've been vulnerable, a little bit more vulnerable with guys, it's not as accepted for. But then for some individuals, like some guys, my best friends, like to this day, and one of my best friends in the cohort I'm in, when I have been vulnerable and opened up, when they kind of accepted that and opened up back, had that conversation with me rather than just me talking at them. It's not like that. Usually end up being really good friends and finding that connection. But I feel like it's almost like guys have difficulty allowing themselves to be emotionally vulnerable. And I think it's more common to be emotionally vulnerable to a woman in the class. And then I will say something too. I've noticed that the amount of support that the women in the class support each other with versus like how the men support each other, and how much I felt in a cohort of mostly women versus like being in a group of guys, and how much support I would feel like hanging out with guys. It's different. I've definitely felt more support in a female like dominated group, and more almost hyped up from my female peers than my male peers.
Yeah.
And I'm not sure why that is, but I see, and I'm almost a little jealous sometimes. I'm like, oh man, like the girls are really hyping up each other right now, and it's like I would like some bros hype me up, like what I'm doing.
Right.
And I don't know why that is. But I will say that, when I first came to the cohort, I did feel a little bit of this hesitation to be vulnerable with the guys. But with the women, I was like, oh, I know they're going to be great, and I know they're going to, have that dynamic conversation with me. Versus if I say something like a little too emotional or vulnerable or something, that seems not how it should be, then I feel like they might try to put me back in that, that box, that male box and that gender box. And I feel like if I don't fit it, I just feel a little different. But again, I'm used to kind of being out and open because of being in mental health and kind of meeting other men who are like that. So I've kind of changed a lot who I am. And when I'm around individuals like men who are like a little bit more guarded and a little bit more not as open, and when you talk about mental health and how our brain works and emotions, and they almost like shut down. They're like, I have no idea what you're talking about. Like it's, I've been around certain individuals like that. And it takes a really slow conversation with those men. And you typically have been clients, but to get them to open up a little bit more and have those deeper conversations. So.
Yeah, it's a lot of good points. I think probably some of it is like has to do with like the hierarchical biological thing, like alpha and like being the leader of the pack maybe, and like how, just my hypothesis anyways, like if you put yourself into like a certain like vulnerability, it may you seem like you're weaker or something, and just like I don't know, it's probably like part of it, the psychology of that. Yeah, so getting back into like your experience with school, I want to talk about burnout. Have you had any experience with that? Heard about it? What are your experiences?
Yeah, so I've definitely have been. I really felt a little bit of strong burnout. I think in the second semester, but I think that's the nature of the program, like OT programs. But I think it's because they try to, at least my program, it seems to be they try to teach you to prepare for the MBCOT exam because we need to pass that to be registered and then to get the licensure to apply for license. And so I feel like the program has really geared more toward the test than things I might be interested in as a future practitioner. Or like my interest in coming into the program is I want to be the best OT I can be and the best healthcare provider or practitioner I can be within the roles that I choose to be in. But I've been having difficulty diving into some of those deeper realms of study, and some of those deeper questions haven't been necessarily accepted as much as I would like to. But and I understand the hesitation behind it is they want me to focus more on MBCOT exams material rather than maybe seeking out my own interest and seeking out my own further development of practitioner. Because I came into the program, most people in our program are straight from college. And I'm one of a handful of individuals who have, years of experience, like 4 years of experience working with individuals, in a clinical sense. And so having that experience, I feel a little ahead on certain topics. Like when we talk about therapies of self, I feel like a little bit ahead. Like I already have practice. I understand, that. And we had a psychosocial class, and I had to, I felt like a little bit like thought this was like very simple. I was like, oh, this class is too simple. Like, and so I think I felt a lot of burnout when I lacked autonomy in my decisions. When I basically had to read this textbook and I had to read these articles, not because I felt it was meaningful to me, but because I had to check the boxes to get through the program. And I think for me, that's when I was really reaching burnout. Is when school became more of a, instead of, oh, I'm really interested in OT and I want to learn more about these things, to a, oh, check the boxes to get through the program to do the things you want to do. And so for me, I've had to engage in more rest and leisure activities, and really try to take a break from the being so intense in my studies in school, and then try to do more things that are beneficial, that really bring me to the value of OT and the profession of OT. That's not necessarily like in education. So I've been listening to a lot of podcasts about OT, as well as I started a Instagram and TikTok called the Bro-T Brain with a friend in the cohort. And we've honestly collaborated with a lot of the other guys, and we've become kind of famous on campus as like, oh, that's the Bro-Ts. Like, so it's, it's, I've really enjoyed having a more not so pressured, checking the boxes activity that still relates to OT and still relates to my career. It doesn't feel like, it's like, oh man, I have to make sure that font's the right font and the right indentation. And
Right.
So it's like, oh no, I just got to make sure this is fun and I'm having fun. So
yeah.
But yeah, burnout's not so bad now. I feel like I've kind of figured it out.
That's awesome. Yeah. In a way, you used OT on yourself, like what you learned, and you're putting it into practice.
Exactly. I mean, if I think it's beneficial for other people, I can definitely help myself. Except in evaluating my own occupational orchestration and some quality of life, and doing some interventions. So
yeah, live and breathe it first. Yeah,
exactly.
And one thing I will say for those of you out there, and you yourself, like, is just part of the process, and just gotta like see the light through the end of the tunnel. Like, it's like that burnout is like this big deal nowadays in like healthcare, and I think just trying to like look more broadly in other areas and just focusing on like what, like you said, what's meaningful and interesting, and like what you need, like as a human, like whether it's leisure or rest, and like just balancing things out can make other things like easier too. Like if you get a lot of rest and you're like had a good time like with your buddies or something, then you can like really dive into like something like really like boring or like a font size or something, it's like you have that energy again, and then you like move past that and you defeat that, and then it's like check that box, like yeah, I did that. And then you could do so much more if you can like handle that one topic or like one whatever it may be, like fieldwork position. It's just like it's a good like life goalpost thing, that like achievement milestone.
Exactly. I mean, for instance, if I was doing research on something I was interested in versus something I was being told to do research on, I would be willing to, I think the 20 hours of editing, like, hours and hours of editing and reading articles would be much more enjoyable if it was something like I was genuinely interested in, and thought it would advance me in some way or advance the profession in some way. So
yeah,
definitely.
Cool. With that, it's time for wrapping it up and getting to our lightning questions. So we're gonna power through these. You feeling like you're ready for it, Curtis?
All right, I'm ready to shoot off lightning from my fingertips.
Okay. First one, how would you describe OT to a stranger on the street?
I would say that occupational therapists use an older definition of occupation, meaning occupying time. So the occupational therapist can work with you on any meaningful activity that you do to occupy your time, and that includes rest and sleep.
That's awesome. Nicely said. I agree with you 100%. With that said, what's your personal recent favorite occupation?
This is it's a hard question. Ooh, I will say that I enjoy work. That sounds interesting. Maybe a lot of people wouldn't say that, but work with a great goodness of fit. So goodness of fit would be, a good people, environment, occupation, as well as performance, having that right challenge. So in the past, when I would say the most content and happy I've been is when I've worked, 50, 60, 70 hours a week. And I wouldn't have minded it because I really enjoyed the work I was doing. For instance, as a camp counselor, when I was doing the PAC case management, I really enjoyed the work I was doing. I thought it was meaningful and rewarding, and I could, really do it all day long. I could do it 12 hours a day if I needed to, because I just enjoyed it that much.
Yeah, there you go. That shows that work can be a thing that you can do that is like, doesn't burn you out either.
Yeah, with the right fit, right? And you need the right right fit in there to have that work be so awesome.
Yeah. And what's something that you read about lately or learned that you recommend to our listeners?
So recently I had some research on the long haul COVID symptoms, and I would say something about that long haul COVID and the symptomology behind it seems to be affecting those who had the initial infection of COVID-19 but didn't actually need hospitalization. So if people out there are experiencing, fatigue, brain fog, increased anxiety, depression, these may be symptoms, neurological symptoms of long haul COVID, and maybe start working with your practitioner or, an OT, things that you may need to do. May not just be life, it may be actual symptoms. You may not be, what's the word, psychosomatic. You may not be psychosomatic. You may just have
Right.
actual going on. So just be aware of those things. That's the one thing that I've been reading recently about some of the research I've been doing, and then there's some preliminary research showing the effectiveness of hyperbaric oxygen therapy for individuals with COVID-19 and long haul COVID-19 symptoms. So
Yeah. Be on the lookout. A lot of exciting research that, think about something we haven't known about and worked with. So, and last, what's your big takeaway, Curtis, from today's episode?
yeah, so for me, I love being able to. I really just enjoyed the conversation with you, Jeff, about just talking with another male OT, future OT over here, but another man who is interested in the field of OT, and hearing how you got in, and especially hearing that why we got in was very similar, and just to really talk about, like, again, to hear about how awesome OT is and how you can really make the profession your own. Really just take it where you want it to go. So that's my biggest takeaway. I just really enjoyed the conversation and hearing how big OT is. So
There you go. Well, I love having you on. It's awesome having another conversation with another T. I think the last time I had a really meaningful, like, long conversations with my cohort, and they're all working and doing their thing, and we lost touch. So it's definitely cool what you're doing with, like, your content. So looking forward to that. How can we find out about you and what you got going on?
it's not just mine, but we kind of collaborated with the other men on campus. It's called BROT Brain, so it's BROT_brain. We have Instagram, TikTok, and we have one podcast out on being a man and being in an OT program. And there's 5 of us on that. So you can reach out there. You can add us on social media and listen to our podcast. We would love to have your feedback too.
Awesome. Well, thank you guys for listening, and thank you, Curtis, for being on the show. And have a good one, man.
All right. Thank you so much, Jeff. Appreciate your time.